Hello, my name is Linda Deadrick, and I'm a registered nurse who has worked for Memorial Hermann Hospital System for over 26 years in multiple roles. Presently, I'm a certified clinical documentation integrity specialist for 13 years. I have a broad work experience both in and out of the hospital, in the emergency center, skilled nursing facility, home health, case management, acute rehabilitation, psychiatric and mental health, pediatrics, and some private duty nursing. In 2017 to 2018, I have attended Lamar University Baccalaureate Nursing Degree Program. And in my capstone presentation, I'm going to be discussing student learning outcomes listed in the Lamar University Undergraduate Nursing Studies Student Handbook. There are 7 student learning outcomes within 5 constructs that will be discussed in detail. I'll include how each outcome was met within the course of study along with the assignments. I have also provided my 5-year career plan upon completion of the RN to BSN program at Lamar University. The first construct that I will discuss is humanity and society. The student learning outcome is practices safe and effective holistic patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I met this objective in Nursing 4540, Nursing Practice Care of Communities. And one of the assignments was Introduction to Community Health Nursing, Nursing Practice of Communities, where I provided individualized based care in diverse communities. Also identified community health nursing practice versus population focused practice. Another assignment was the Practicum Project Teaching Plan 4 and the Practicum Project Plan Form number 1 and Windshield Survey. And this is where I provide teaching and education on emergency disaster preparedness and planning for people in the community as well that would be devastated in case of a disaster. I also identified special needs population within communities and social services provided. Another assignment was the global health discussion, identified global health issues, disease in countries with high prevalence rates, and also factors that contribute to high prevalence rates and the impacts it has on those countries, and a better understanding and researching of international agencies that help combat this disease and illnesses in these countries. The next construct is Lifespan Health Continuum. I met this objective in Nursing 4316 Comprehensive Holistic Health Assessment throughout the Shadow Health. And I performed simulated comprehensive holistic health assignments with both a child, a young adult, and 2 elderly patients. I educated these patients and family on disease process and disease management, nutrition, medication compliance, health and wellness promotion, and disease prevention. Another learning outcome in the Lifespan Health Continuum is evaluates patient-centered care for patient or clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. And I met this objective in Nursing 4620, Nursing Practice, Care of Patients with Compromised Multiple Health States. With this was the assignment Practicum Reflection Papers 1, 2, 3, and 4. And I interviewed and evaluated a patient with a compromised health state who had a C5 through C7 fracture. I provided patient-centered care. Education, was an advocate for this patient, provided referrals outside of the hospital due to his disability, and he had no caregivers that could assist him outside the hospital. Also, I did collaboration with the multidisciplinary team so that we could make sure that this patient has a program both in and outside of the rehabilitation hospital and a program when he leaves the hospital with a good discharge plan. The third construct is evidence-based practice and clinical reasoning. And this was met through Nursing 4390, Nursing Inquiry, and Evidence-Based Practice. I did some assignments on quantitative research article activity, qualitative article and clinical practice, and quantitative research article critiques. I was using evidence-based research and data for increasing patient safety, improving quality of care, and better patient outcomes. Also, understanding different types of quantitative and qualitative research. This was instrumental in analyzing and researching quantitative and qualitative articles that helped me a great deal in my work today. I applied clinical understanding, reasoning, and critical thinking skills in my nursing practice. Another construct is patient-client-centered care. And this objective was met through Nursing 4321, Nursing Theories and Online Education. And the assignments were Focus Insight and Nursing Philosophy. This to help me understand nursing theories and philosophy of nursing. Research evidence-based nursing practice to provide safe and efficient and individualized patient-centered care. The organization research for nursing philosophy that I did was through the American Nurses Association 2015 was Provision 3. The nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. The last construct was professional roles, and the learning outcome was differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patient clients as a member of the interprofessional and intraprofessional healthcare team. I met this objective in Nursing 4321, Nursing Theories and Online Education. And this assignment was differentiated essential competencies and ethical issues. Differentiated the nursing roles and responsibilities, as well as participating in multidisciplinary teamwork in patient-centered care. Learn to understand legal and ethical and regulatory issues such as the local, state, and government in nursing practice, and providing information to patients and families on making ethical decisions, and also teaching them about advanced directives, having living wills, and providing those to the hospital. Another student learning outcome under professional roles construct was demonstrates professional integrity, effective communication, active inquiry, in service to the community. And I met this objective in Nursing 4550, Nursing Practice, Leadership and Management in the Healthcare System. This assignment, Effective Leadership and Qualities in Healthcare Quality, gave me a better understanding of different leadership styles, the roles, their responsibilities, and how they impact nursing practice, as well as healthcare costs and containment strategies, as well as improve patient outcomes. Using professional nursing skills to provide effective therapeutic communication, to provide safe and high quality care, and advocating for the patient is one of the ultimate goals and should be a necessary component for leadership. For my 5-year goal, Capstone career plan, I have provided a short term for progressing in a managerial position to apply my education, skills, experience, and abilities. And my midterm, which is 2 to 5 years, is complete my master's and or doctoral degree program to advance into a leadership position and support nursing leaders in developing and promoting nursing research and evidence-based practice. And another for my long-term goals, which is 5 years or greater, a position in executive leadership role within a healthcare organization while providing culturally competent healthcare in all spectrums of the industry. Thank you so much.